You're rinsing a coffee cup at the sink when the vision in one eye suddenly dims, like someone pulled gray fabric across it. 10 seconds, maybe 20. Then it clears, and you go back to your morning like nothing happened. That moment isn't nothing. It may be one of the clearest warnings the brain sends before a stroke, and it's one of the easiest warnings to miss precisely because it disappears so fast. Today we're going through 5 of these warning signs, what's actually happening inside the body when they occur, and what to do if you ever experience one. This isn't a substitute for medical care. It's the kind of information that helps you recognize the moment to seek that care urgently instead of waiting it out. Let's start with the basic biology, because it explains everything that follows. When doctors say stroke, they mean one of 2 very different events that share a name. One happens when a blood vessel in the brain ruptures and bleeds into surrounding tissue. The other, far more common, happens when a vessel gets blocked, usually by a clot, cutting off blood flow to part of the brain. About 85% of strokes are this second kind, the blocked vessel kind, and this is the kind that tends to give warning first. Here's why the brain is so sensitive to even brief interruptions in blood flow. It weighs about 3 pounds, a small fraction of total body weight, but it consumes roughly 20% of the oxygen you breathe and a quarter of the glucose in your bloodstream. Unlike muscle or fat, brain tissue can't store reserves of fuel. It needs a continuous supply, moment to moment. Cut that supply off completely, and brain cells begin dying within minutes, not hours, minutes. That's the backdrop for understanding what's called a TIA, a transient ischemic attack. It's sometimes nicknamed a mini-stroke, though that name undersells it. A TIA happens when a blood vessel is blocked just briefly enough that the tissue starves but doesn't die, and then blood flow returns, often within minutes, and the symptoms vanish completely. No lasting damage. No trace on a basic scan, most of the time. Here's the number that should change how seriously anyone takes a TIA. Research has consistently shown that roughly 1 in 3 people who experience a TIA will go on to have a full stroke, and a meaningful portion of those strokes happen within the following 48 to 72 hours. That window, the first few days after a TIA, is when the risk is highest. A TIA isn't a near miss you can file away and forget. It's frequently a preview, and the body is in effect giving advance notice before a much larger event. With that in mind, here are 5 patterns worth knowing. The first, sudden vision loss in one eye. This is sometimes called amaurosis fugax, temporary loss of vision in one eye, not both, lasting anywhere from a few seconds to a few minutes before clearing completely. It doesn't feel like blurriness or smudged glasses. People often describe it as a curtain or shade coming down over the eye, or as though someone dimmed the lights in that eye alone. The mechanism is straightforward. The carotid artery in the neck carries blood up toward the brain and has a branch that supplies the eye specifically. A small fragment of clot or plaque can break loose, travel into that branch, and temporarily block blood flow to the retina. Once the fragment moves on or dissolves, vision returns. But the fragment doesn't simply disappear. It often continues toward the brain, which is why this particular symptom is taken so seriously in emergency settings. The key distinguishing features: it's sudden, it's confined to one eye, and it resolves within minutes. That's different from gradually worsening vision over days, and different from the brief visual sparkle some people get when standing up too quickly, which is usually a blood pressure issue rather than a vascular blockage. The second, speech that suddenly breaks down. This is different from the normal, frustrating experience of forgetting a familiar word, something nearly everyone deals with as they age, and that has nothing to do with stroke risk. What's concerning is when the entire mechanism of speech malfunctions, not just word retrieval. There are 2 recognizable patterns. In one, a person knows exactly what they want to say, but the words come out slurred, garbled, or don't come out at all, as if the connection between brain and mouth has been interrupted. In the other, words come out clearly, but they don't form coherent sentences, or the person suddenly can't understand what's being said to them even though they can tell someone is speaking. Either pattern, appearing suddenly and lasting anywhere from a minute to several minutes before fully resolving, is significant. This happens because 2 distinct brain regions handle speech, one that generates the motor instructions for forming words, another that handles language comprehension and meaning. A brief interruption in blood flow to either region produces a brief but very real glitch in speech, even if everything returns to normal afterward. The third, a pattern that gets less attention than it deserves. Autoimmune skin conditions paired with new headaches. This one is more nuanced, and it's worth being careful with the science here rather than overstating it. Vitiligo, the patchy loss of skin pigment, is an autoimmune condition, meaning the immune system mistakenly attacks the body's own pigment-producing cells. Some research has explored associations between autoimmune and inflammatory conditions, and vascular inflammation more broadly, since the same kind of immune activity that targets one tissue can, in some people, contribute to inflammation in blood vessel walls. This is an area of ongoing study rather than a settled direct cause and effect link, so it shouldn't be treated as a guarantee, but it's a reasonable thing to mention to a doctor if it applies to you. What matters more directly is the headache pattern itself. Most headaches in older adults come from far more mundane sources: neck joint wear, tension, sinus issues. Those aren't stroke warnings. What deserves attention is a headache that's genuinely new, more severe than your usual headaches, occurring in a different location than you're used to, waking you from sleep, or simply not responding to the over-the-counter medication that's worked before. New plus severe plus different is the combination worth flagging, particularly alongside any inflammatory condition. It's also worth noting that stroke warning signs can look different in women than the textbook symptoms typically described, which tend to be drawn from research historically focused on men. Women are more likely to report symptoms like sudden severe fatigue, brief nausea without other stomach symptoms, an unexplained mood shift, or a short episode of confusion, symptoms that are easy to misattribute to anxiety, hormonal changes, or simply a bad day. If something like that happens and it feels distinctly wrong, it's worth taking seriously even if it doesn't match the more commonly cited symptoms. The fourth, a sudden loss of coordination or balance. Picture walking a path you've walked 1,000 times, through your own living room, and suddenly misjudging where the floor is, stumbling, catching yourself on furniture, or reaching for a glass and missing it slightly, or a brief sensation that the room is spinning while you're standing perfectly still. This relates to the cerebellum, a structure at the base of the brain responsible for coordinating movement and balance. It's supplied by arteries that run up through the back of the neck and spine. A brief interruption in that blood supply produces exactly this kind of sudden clumsiness or vertigo. The distinction from ordinary dizziness matters. Rolling over in bed and feeling brief spinning is usually an inner ear issue. Standing up and feeling lightheaded for a few seconds is usually blood pressure. What's different here is that it happens during normal activity, out of nowhere, and involves the body failing at something it does automatically, judging where your foot is, where your hand is, where the floor is. The fifth, sudden numbness, almost always on one side. Pins and needles in one hand, an arm that suddenly feels wrapped in cotton, half of the face going slack, one leg not quite responding. The defining features are that it's sudden and it's one-sided. This connects to a basic fact about brain anatomy. The left hemisphere controls the right side of the body, and vice versa. A vascular event on one side of the brain produces symptoms on the opposite side of the body, which is why genuine warning signs are almost always asymmetric. If both hands go numb evenly, that's more often related to the neck or spine than the brain. The duration is typically brief, anywhere from 30 seconds to around 10 minutes, and then it resolves completely, which is exactly what makes it so easy to dismiss as having imagined it, or as the arm having fallen asleep from an odd position. The real test: did it happen out of nowhere, with no obvious positional cause, and on just one side? If so, it deserves attention even after it passes. What ties all five together? Each of these symptoms traces back to the same underlying issue: damage to the inner lining of blood vessels, called the endothelium. Healthy endothelium is smooth, allowing blood to move past without anything sticking. Damaged endothelium becomes rough, and over time, cholesterol, platelets, and other debris accumulate on those rough patches, gradually narrowing the vessel. Two of the biggest contributors to that damage are chronically elevated blood sugar and smoking. Blood sugar that runs high, even before crossing into a formal diabetes diagnosis, causes ongoing microscopic injury to vessel walls. Smoking does double damage. It injures the vessel lining directly and makes blood more prone to clotting. People who smoke face roughly 2 to 4 times the stroke risk of non-smokers with otherwise similar health profiles. One counterintuitive point worth knowing: while elevated blood pressure over years is what causes the underlying vessel damage, the actual stroke event sometimes occurs when blood pressure drops. For instance, during the natural dip in blood pressure that happens during sleep. If a vessel is already significantly narrowed, that ordinary nighttime drop can be enough to cut off flow entirely, which is part of why strokes are disproportionately discovered in the early morning hours. What to actually do with this information? If any of these 5 symptoms have happened to you, even once, even months ago, and even though it resolved completely, it's worth bringing up with a doctor directly rather than mentioning it in passing. 3 tests are commonly used to investigate exactly this kind of history: a carotid duplex ultrasound, a painless, non-invasive scan of the neck arteries that shows how much plaque has built up and how freely blood is moving through, a hemoglobin A1C blood test, which reflects average blood sugar over roughly the past 3 months rather than a single reading, and can catch prediabetes level damage well before a formal diabetes diagnosis. Holter monitoring, a portable device worn for 24 hours that records heart rhythm continuously, which can catch intermittent atrial fibrillation that a brief in-office EKG often misses. AFib allows blood to pool and clot in the heart, and those clots are a significant cause of severe strokes. And if any of these warning symptoms happen in the moment, don't drive yourself anywhere, and don't take aspirin without medical guidance, since roughly 15% of strokes are the bleeding type, where aspirin can make things worse rather than better. Sit or lie down, and get medical help as quickly as possible by calling emergency services rather than waiting to see if it passes. The thread running through all 5 of these signs is the same. They are often brief, they are often dismissed, and they are often the only warning the body provides before something far more serious. Taking them seriously, getting them checked rather than explained away, is the single most useful thing this information can offer.